On today's On the Other Hand, we talk with two people that are working to help Arkansans come together and make our state better. Here's a sneak preview.
And it comes down to priorities and what we as a society decide that we want to fund.
This is On the Other Hand, a podcast that features community leaders in Arkansas sharing their views and experiences on how to make our relationships and communities better in the state. In the first part of our conversation with Grant Morshedi and Angela Harris, Grant and Angela shared some interesting things about how their personal backgrounds have actually influenced their work. Grant coming from an immigrant background and Angela coming from her work with her mom with the nonprofit in the nonprofit area. And one of the things that kind of came through as a thread along with that, those personal values, was the value of empathy. I think it was Grant that said that we have to have enough emotional bandwidth and enough emotional intelligence to understand another person's point of view. And that reminded me so much of what we do here in Braver Angels. Grant also challenged our listeners to think about, if an issue affects other people, then it's an issue that is worth caring about. Yet, at the same time, the whole issue of healthcare is so complicated that it's a hard issue to solve.
And a couple of things that really stood out to me in our conversation with Grant and Angela, I forget who it was that said it, but it was basically the point that anybody can be vulnerable to poverty unless you're maybe inherited generational wealth of some sort. So it was the argument for having some degree of empathy and concern and understanding for why places like Harmony Health are needed and important, because so many people out there, they're not there just because they're lazy and they won't work. They're there because something bad happened in their life that complicated matters and made it difficult for them to have a living wage or to have to make a choice between diabetes medication or the next month's food bill or something like that. That was important, and I think that kind of went along with that discussion of empathy, which was kind of interesting to me as well. The other thing that I thought was a good point, they talked about the ways in which the clinic, by providing these services, in some ways is actually saving taxpayers their money because they're able to help people early on who would not otherwise get medical care. And if they did not get medical care from Harmony Health, their conditions would worsen and they'd wind up in an emergency room where the costs are much higher and the outcomes much poorer and just be more healthcare costs in the end. So I think they made a lot of good points. And then on a little more of a superficial point, but something I think was really neat, I loved hearing about how they have some of their funding derived from them sponsoring the World Cheese Dip Championship. Go Cheese Dip.
That was awesome to hear about, and a little bit of the history of that as well. Well, now let's get to the second part of our conversation with Grant Morshedi and Angela Harris.
In these politically divided times that we have right now, there's a big controversy over the role of government, how much government should contribute to people's overall services and welfare, and that certainly includes public health needs. It's being reduced in a lot of ways now, and in the views of some people, that's a good thing. That does, however, leave a lot more responsibility to the private sector and to relying upon volunteer or philanthropic resources to meet those needs. So I wonder how you all at Harmony Health are adjusting to this pressure, and how are you managing to meet these needs as they increase and the governmental resources decrease?
We've seen changes. The last time that there was a bulk of patients that were kicked off Medicare or Medicaid, sorry, not Medicare. We saw an uptick in our patient applications and medical needs that they have, and we know we have quite a few people that are coming in and asking, hey, if I get kicked off on this next round, will I be able to become a patient? And we walk through with them all the steps to do all that. So the work we do, I feel like some people may not agree with it because it's free healthcare, but at the same time, we're keeping people, especially diabetic patients, for example, we're keeping them out of the ERs and taxing that healthcare system. So I feel like we're making a difference helping with that as well. So the taxpayers aren't necessarily paying for that. Um, we rely slowly here on donations, grants, fundraisers that we do. So it's making a difference in people's lives. But at the same time, I feel like we're also, in a small way, not of course, we're also helping some of the larger hospitals as well. Um, and hopefully keeping patient wait time down and being able to treat them here and give them their medications as well.
Angela, you had talked about some of the options for funding and making
Mhm.
up for the lack of governmental support. So I wonder if there is anything that you could tell our listeners who might be inclined to be supportive. What do they need to know about the options for volunteering or making donations or somehow being involved in helping Harmony Health?
There's so many different ways. If you're interested in donating, you can go to harmonyclinicar.org. And anything from like $30 would help buy a glucometer for a diabetic patient or a blood pressure cuff for them to monitor their blood pressure at home. Um, Something like $400 would pay for an entire set of dentures for a patient, and they'd get their smiles back. There's anything from monthly donations that you can do. We're on Smart Change, which is a neat app. You can sign up and just roll up your change. So I tested it out, and when I go grocery shopping and things like that, it'll roll up once a month, and I donate that way back to the clinic. There's other ways to plug in volunteers. We've talked about that as well. But every year we have two large fundraisers. One is called Bollywood Nights. It's always in the late spring. We're on, I think, year 17, maybe 18 is coming up this year. And I've put on fundraisers for 20 years. It's the most unique one I've been to. It's really neat. It's Indian theme. We have Indian cuisine. We have fashion show. We have dances. Some are Bollywood-esque, so they're more upbeat. And then we have some classical. You learn a lot of different things. We've had so many people from the mayor. We have Secretary of Health that'll come out. Then we have this year we had someone come down from Canada, one of our sponsors. We had people from Texas, all over, and it's a big, fun, unique party event. And at the end, there's a big dance party, and it's a lot of fun. And then we also have the World Cheese Dip Championship, which I have to say, Greg's wife was the chair of, not Greg, sorry, Grant's wife was the chair of for a few years, and it's fun. If you love cheese dip, it is the place to be. We have so many different restaurants and caterers that bring out and compete to be the best and win an award every year. And we also combined the other half of the event with one of my old fundraisers, Foam Fest, which was the first craft beer festival in Arkansas. But we keep them a little bit separate. So one side has the cheese dip, and there's huge kids zone and bouncy things and face painting and all the fun. And the other side, you can do the craft beer festival if you want, or you can do both. So we make it a lot of fun. I do write grants a lot. We have right now the only federal fund. We don't get federal funding. We were awarded one, but I'll let Grant talk about that fun one. We do get some funding with the state through the health department every year, where all the charitable clinics are a part of the rural health kind of department. The rest are great funders like Delta Dental, Patterson Dental, Arkansas Blue Cross Blue Shield, Wellspun will also donate. And there's options that people can also donate from their own personal as well. But we have funding from very different ways, but we also always are in need.
A lot of options, it sounds like. Grant, I want you to be sure to tell your wife thank you from the bottom of my heart for the cheese dip championship. Cheese dip, and I have a weakness for cheese dip, and so
But
I love
so
that.
I do have a question about that because I had no idea it was connected to Harmony House. So is it are you just one of the sponsors for it, or
We
is it
actually kind of
completely
inherited it.
you tell me about that. Tell us about that.
Years ago, I'd have to go back and look at the date. There, with the Little Rock Film Festival, there was a documentary on the beginnings of cheese dip. And apparently it started in the state of Arkansas. They say is Mexico Chiquito started it. Of course, there's other restaurants that kind of say, well, we had it too. So you just never know. It's kind of a fun little back and forth that they do. From there, started the World Cheese Dip Championship. And a few years later, the volunteers that all started it decided to give it to Harmony Health Clinic as one of the main fundraisers.
Wow. Well, wonderful that they
Yeah,
saw that as being important.
we were lucky because it has a great following and it's fun. It's so much fun every year.
I was looking it up on the website as you were talking, and it looks like it was last June. So does it typically happen in the summers?
Normally we had it every October, but this last one we had so many conflicting events that popped up around the same time, and it's so busy because when you're in Arkansas you have to plan everything around the Razorbacks football schedule, which I had to learn that when I moved from Texas. But we thought we would try it in early June to see, and we had tons of people come out. It was great weather. It rained that morning, but we were at Dickie Stevens, so we were able to keep it under the concourse, and there's so much room to grow and make the event even bigger and better.
So that may be a permanent kind of change for you then.
It might. We're debating it right now.
We shall see. All right. Back to something a little more kind of on the downside. It's about the funding of healthcare. I looked at your website and I noticed that it seems apparent from the way you describe things on the website that you feel the United States should join the rest of the major countries in the world in providing some form of broad government funded health care. So I wanted to give you a chance, and this may fit too with Angela. She said, Grant, you may want to say something about a grant that you were going to be given. So it all kind of works together, this idea of government funding versus the private sector. What is the state of healthcare when it comes to the limited resources and them being more limited coming from the government now? And, what do you see happening?
Let me start by addressing the funding situation. As Angela mentioned, Harmony has always been funded by a combination of donors, corporate, individuals, foundations, and historically only a fraction of that's come from governmental sources. When we were founded, we were allowed to use a vacant building that we're still in that is owned by a government agency, and we've renovated it, we've maintained it well, and in return, they've allowed us to use it rent free, which has been huge. And that's the largest amount of government assistance that we've received. Unfortunately, last year we were notified that they're going to be selling the building, and we're now in the position of needing to figure out how to increase our funding to pay for rent or purchase the building to continue to be able to provide our services. We were able to, as Angela alluded, due to Angela's very hard work, secure a generous, competitive federal grant from the CDC, which would have absolutely transformed our situation with regards to the facilities, set us up for success moving forward for many years. And we just signed the papers when we got notice that our grant was canceled by DOJ. So at the moment, we are back to square one, but still really amped up about this and preparing for a capital campaign to raise enough funds to hopefully purchase a building. So the really difficult part about this political atmosphere right now is that these across the board funding cuts to public health infrastructure and especially Medicaid funding is actually projected to really increase the need for our services at the exact same time that the funding for those services is being cut. So we're being hit from both sides on that.
Wow.
So I'm curious about how you advocate with people who maybe are in favor of that kind of that kind of cutting of waste in the government, or what they perceive to be waste in the government, and manage to still advocate with those folks across the political divide who might be not seeing the value as much, but they value your services. How do you manage to have those conversations?
That's pretty nuanced, as you might imagine. And I think there can be a little bit of a cognitive disconnect between supporting the idea of something, but then when it gets down to the nitty gritty details, not wanting to support that line item in a budget or a bill in favor of something else. And it comes down to priorities and what we as a society, as a federal government, as a state government or local government decide that we want to fund. And it's not about cost. I mean, you think about the amount of dollars that get thrown around in this country, the lobbying budgets of major corporations, the billions of dollars of profit for-profit health insurance companies that get returned to their shareholders, how much our government spends on military obligations. The amount of money we're talking about here is staggering and would easily, sustainably support many social safety net programs if that's what we chose to prioritize. And so this divide, this debate has been around as long as our republic has been around. It's one of the most defining features between conservative and liberal political philosophies is what the role of government is in funding those things. So I think we just have to get back to whether we want to take care of our neighbors in that way or not.
Yes, I mean, it does come down to values. It does come down to priorities. I think, in Braver Angels, we often hear from leaders in the community who try to work across and engage those various political divides. And I would like to know if you've had any success stories in working with people from various perspectives and backgrounds. And if so, maybe you could share, what your approach is within those kind of examples.
For me, it's every day, and it's not political discussions. It's I'm a physician, and the healthcare field is full of these stories and challenges. People come to me from all walks of life, so I'm in the position daily of having to listen to, empathize with, and take care of patients with whom I might not have very much in common at all, socioeconomically, ethnically, politically, racially. And it's particularly evident when we have a situation where a patient from a historically marginalized group, or a group that maybe has a checkered past with the medical field. There are plenty of stories where medicine has treated people poorly. So there can understandably so be a lot of mistrust and apprehension to even get to the point where they're setting foot in my office. So I really find it vital to spend time, as Angela was alluding to, that happens with patients at Harmony. Same thing in my clinic. You got to build rapport, build relationships by kind of active listening, asking questions that make the person feel seen, feel heard, and over time they understand that we're on the same team. That I'm striving to do what's in their best interest. I'm not just part of the machine and in it for money or whatever that people may feel. So giving them time and space to vent if they need to vent, finding common ground, discussing common experiences, and then using that as a foundation to build up from there to more complicated discussions.
Well,
And
that
I
makes
think that,
sense.
yeah, I think that parallel can be used for really any discussion in your life.
Yeah, building relationships, and certainly is consistent with what we do in Braver Angels. Angela, I can imagine on the fundraising side of things that you also are, you know, kind of this tightrope maybe of walking about. You realize that a person might be politically in one camp or another, and yet their funds are important for your organization. So how do you go about working through those difficulties?
Fundraising I've learned over the years is all about relationships. There are people that will donate to your cause because they believe in it, but it's also about making the relationships with the donors, even at the corporations, be like it's so we can have a mutually beneficial a return on investment that they're entrusting us with their funding, and that they can trust us with we're going to do what we say we're going to do, that we're going to spend it responsibly, and we can report back on exactly where the money went. I think it goes a long way. We I've worked with people that, that are typically on both sides of the fence, and it so far I've been lucky it hasn't really been an issue. Because when I come to them with patient stories and showing them that the work that we do is important and the lives that they are impacting, I think they stop and go, okay, it's not just about me. It's helping the greater good, and also and it's making a difference in lives, but it's also helping keep people out of ERs, stuff like that, like I alluded to earlier. So it's not as taxing on certain other dollars. So it kind of comes out in the wash a bit.
Yeah, I mean, ER is often used as the primary care provider for many people who don't have insurance. So let's talk about the stories, because I think that gets the empathy that
Hmm.
you brought out earlier too. So I've been reading a book recently by Brian Goldstone, a new book called "There's No Place for Us: Working and Homeless in America." It's really impacting my thinking and increasing my own empathy because he's telling engaging stories, specifically in the Atlanta community, about the working homeless. And I believe in Braver Angels, we talk about this oftentimes. If we can hear each other's stories, right, it helps us in so many ways.
Hmm.
And so those stories, I want to hear a couple of stories of people that you've worked with that might expand our thinking, our listeners' thinking and empathy related to the needs for your services. And I don't know which of you would like to share on that.
Angela mentioned earlier that healthcare is complicated. It's not just a single issue. We have we can provide access to healthcare for patient with limited resources, but that's really only addressing one facet of the problem. We can give them a prescription or pull a tooth or any number of things that we can do, but addressing their health needs from a holistic perspective really requires much more that we're not able to do. Big societal challenges like socioeconomic status, employment, education level, access to high quality food rather than processed foods. So all of those things impact someone's ability to just be a functioning human with dignity who has sort of self-determination and can do the things they need to be able to do. And we see little snippets of that in things that we can help with in healthcare. So I'm an ophthalmologist, and I take care of patients with cataract and glaucoma. And I've been referred patients from Harmony who have these things. And specifically with cataract, I told you that's how I got into this field to begin with, was by seeing a patient who had cataract surgery and how life changing it can be. And in a lot of my international work, it is striking. You have a patient who may come in and they're of working age and their cataracts are so bad they can't even see their hands in front of their face. And but when you take a cataract off, you transform their life. They can all of a sudden provide for their family, and they can sometimes we have patients who see their kids or grandkids face for the first time. They've been blind for so long. So we don't have stories that striking in the US. Fortunately, we don't typically get to that point. But even so, a cataract can take someone to the point where they are struggling they may not be able to drive, and if they can't drive they can't get to work, and if they can't work they can't provide for their family, and it's just this cycle. So I've had several patients referred from Harmony that were able to get the resources necessary for their cataract surgery donated and provide their surgery for no cost to them, who have really been transformed and back into a situation where they have some ability to kind of change their situation.
Great. Great. Angela, you have something you want to share? Example?
Well, I have a great story about one of our patients we had come in. He was in his early 30s, and he was just one of those people that inherited bad teeth and grew up on well water, and it just kind of compounded to make his teeth very brittle, issues like that. We were able to do what we call immediate dentures, where they pull their teeth and they'll do immediate dentures where they're they were in, but they come back 3 or 4 times where they adjust the dentures to make sure they fit. Because after the healing and the swelling goes down, it makes a big difference. But when he came out and looked at himself in the mirror, it was right after he'd had teeth pulled, so it was a little bloody. But he was smiling from ear to ear, and he was always very socially awkward and almost insecure. You would never see him smile, but to see him smiling like that made such a huge difference. But from there, he called us 2 days later and he was able to find a job because he gained that confidence and people took a chance on him because he had a great smile and he had teeth and he felt more confident in speaking and working with the customers that he had found a job. From there, he was able to help find his another place for he and his wife and little boy to live that was more secure, more safe, and it just made a difference. We take for granted a lot that, we have good teeth, even if we have to have fillings or you get a little older, you need crowns and all that fun stuff. But just the small impact, we thought it was small, but when you see them, it made a major impact that helped him become more productive in society and be able to hold down employment, things like that. But I have so many stories like that where somebody's come in and they have desperately needed insulin. They've been off their medication and they were at risk of losing, say, toes and things for because due to their diabetes, and we were able to get them back on medications and get them regulated so they didn't actually have to go have surgery. It's just more wound care, things like that. So, and with that, they've been able to be out better, take care of their families and find employment and hold down jobs because when you're diabetic and you're not on the right medications or insulin, you just you don't have the energy, you don't feel well, you can have crashes and it's just made a big impact.
Makes sense. One of the things that I think about Arkansas in particular is that I think we would love to pride ourselves in thinking that we have great health care. And I think we do have great health care for the people who have the means to be able to have insurance and pay for it.
Hmm.
But we don't necessarily always for the people who don't have that. And so I would love for you to talk about a little bit about where you see Arkansas currently in terms of that safety net, especially with respect to health care.
So the answer to this question has changed over the years. We started in 2008. Subsequent to that, the vast majority of healthcare access for patients with limited resources has been the Medicaid program. And since the Affordable Care Act passed, which was after our clinic opened, Arkansas was a leader among conservative states in providing access to healthcare for low-income residents through expanding their Medicaid program from matching federal funds. This is an incredible example of, if you know the history of that, of a bipartisan solution, a carefully crafted solution to a complex problem. And it was really to the benefit of our low-income patients. Unfortunately, since then, this has been whittled down considerably, first through a pretty rocky and, in my opinion, poorly managed rollout of work requirements several years ago for Medicaid recipients. And now with the efforts we're seeing through the federal government to massively cut funding for Medicaid at the federal level. So I'm sure at some point we'll see numbers regarding how many patients have been cut off from Medicaid, but it'll probably take years to fully understand the effects of that on the health of these patients. And so that's really where we are right now with Medicaid. And unfortunately, I think it might get worse before it gets better. I think we're going to have to really have some sort of major event or paradigm shift that will lead to some meaningful reforms. I'm certainly not an expert in discussing what the reforms need to be with healthcare delivery systems. I think there's been some people who advocate for Medicare for all. I would point out that even Medicare right now is kind of a mess. There's a federally mandated budget neutrality rule that creates really significant challenges with fair payments to hospitals and providers, to the level where many practices right now are already limiting their Medicare patients or may not accept Medicare at all. So at least in its current form, that's not in a place that's viable for itself, let alone expanding it as a model to everyone. I've been involved in international ophthalmology work. I know of a lot of eye hospitals in other countries that provide services on a self-pay sliding scale, where those with means pay a certain amount over the cost of their care, and the profit from that allows the hospital to offer services at lower costs for patients with lesser means. And then at some level, patients who are the most needy patients get care for free. So that's an interesting model. I don't think it would work here because healthcare costs way too much. So there will be very few people right now who could even pay the cost of it right now.
Any thoughts about what would help reduce the cost of Medicare in this country? Or is that even a viable possibility?
That's probably, in my opinion, again, there are way smarter people than me trying to figure this out. But from what I see, I think that's probably the most complex question we're going to talk about today, because the economics of that are intertwined with things that go down to the very core philosophies of our country. I mean, free market economics and capitalism, and that being involved, I think, in the healthcare field, there are a lot of areas where, in my opinion, the free market just does not work. There are good parts about it and there are bad parts about it. The good parts about it are we have companies that are able to make large amounts of profit, and if they're able to take that and reinvest it into research and development, we've got companies that are doing great things with healthcare innovations and discoveries. But then you also have health insurance companies that purportedly exist to make the cost of healthcare more affordable for patients, but they're making billions and billions of dollars of profit each year that goes back into the pockets of their shareholders, and that is money being siphoned from the system. So it's complicated, and I don't know the answer.
And I'm not sure anyone else knows the answer either, but I appreciate your giving us a little bit of a glimmer of information on some of the aspects of what makes it so complicated. Um, I think it comes back to something we were talking about before. We were talking about the importance of relationships in so many areas of life. And if people value relationships, then hopefully they're going to be doing something to support people who are less fortunate and are in a bad place, whether it be through donating to Harmony Health or supporting needed reforms in our healthcare system in this country and how it's dealt with. It also reminds me of we were talking about empathy earlier. It seems to me that empathy and relationships go together, right? I can imagine two types of relationships where empathy is involved. You care about the other person as a human being because you know what it might be like for you, and you can see what impacts them. If you don't have empathy, the only thing that matters in relationships is what good can you do for me? And I guess we have some choices to make in this country in that regard. Let me move on. What are your plans for the future? Angela, let's start with you. And it could be for the clinic, it could be personal. Just tell me what you're thinking about for where you go from here.
Clinic wise, our goal is to secure funding where we can find a permanent home that where we can also expand services, and we're a little more stable. And also I feel like once we get that home, we'll be able to better serve the whole patient. Not just we've worked hard on, we've come from primary care to specialty care to dental care, things like that, but we're adding social workers and things like that. We're able to help with behavioral health therapy and also help connect them to all the resources they can find. We can help them, point them in right directions for housing, for, sometimes they need help with utilities. We were able to help some of our homeless friends find actual housing and find jobs. And it's just, we want to be able to be stable where we can continue to make a difference in so many people's lives.
How about you, Grant?
So I'm still on the board of Harmony, and I'm still going to be involved with everything Angela just discussed. We're going to work hard to get Harmony to a place where it's not only sustainable to continue doing what we've been doing, but we can grow from there. I'm going to continue to volunteer to serve the eye health needs of Harmony patients along with my partners at the Little Rock Eye Clinic. And of course, my day job over there also keeps me very busy, so that's going to continue. Otherwise, continuing to stay active in my community, supporting other organizations and political candidates that I see doing good work. And most importantly, I have 2 middle schoolers who I'm going to strive to teach to be kind, empathetic humans and engaged citizens.
Bless your heart. Good for you. We're about to wrap up here. So is there anything else that you'd like to share with our listeners that we haven't gotten to? Angela?
If you're interested in learning more about Harmony, you'd like to take a tour, um, donating, or volunteering, please reach out to me anytime. Our clinic number is 501-375-4400, or go to harmonyclinicar.org. We would love to meet you, love to get you involved with us and see where we can make a difference together.
Thank you. Grant?
Don't forget that access to healthcare is a human right and a basic necessity for a dignified life. And don't forget that you currently live in a country where your fellow citizens don't always have that right. You have the power to do something about it. Support the organizations that are helping, including Harmony Health Clinic, and demand that your politicians do something about it.
Good call to action.
We appreciate y'all's time. Thank you so much for joining us and for telling us about Harmony Health and the good work you do there.
Thank you for having us.
We hope you enjoyed this second part of today's conversation with Grant Morshedi and Angela Harris. Remember, On the Other Hand offers dozens of interviews with other guests. You can find each of those conversations inside your favorite podcast app or on the podcast page of the Braver Angels Arkansas website at arkansas.braverangels.org.
On the Other Hand is sponsored by Braver Angels in Arkansas. Music was composed by Randall Standridge of Jonesboro, Arkansas, and was performed by the University of Northern Colorado Symphonic Band, Dr. Richard Main, conductor.
From your host, Glen White,
and April Chatham Carpenter.
Join us in working to make our relationships and communities better.